Thank you, and thank you for attending this afternoon. So I'm going to give you an update on the company, where we are. We'll give you a couple of unique twists. This is Breast Cancer Awareness Month, so I'm going to urge all of you to get the women that you love out to breast cancer screening, which is a proven modality to really save lives. So it's critical that everyone understands that. But also then we put out a 4C today as well. So I'm going to update you on some of the Q2 results we put out earlier today. So let's just a quick overview. We are a software company. We apply AI to breast images, and I'll show you some examples of that. My focus for the last 30 years now has been the reduction of deaths from breast cancer. It's around 500,000 each year. Women will die, tens of thousands of those in New Zealand and Australia. Sadly, so my aim, my life really has been dedicated towards reducing that mortality. It is a big commercial market. We believe the market for software, AI software such as ours in breast cancer imaging is around the 750 million annual recurring revenue line. We've got, picking up some of the earlier talks in, we started off in Oxford, obviously, but we're based over in Wellington. We are listed on the ASX, but the US is our big market. But we are involved in 37 other countries around the world, and we are first mover in a lot of what we do. So I'm going to really do a deep dive on some of the things that we do. As of today, around 25.8% of the US market, so it's around 1/4 of all women that get breast cancer screened in the US, have the benefit of one of the Volpara products. We're on track for 27% by the end of our year, which is the end of March. We have annual recurring revenue now for 15.7 million at the end of Q2, on track to what we said, 17.1 million at the start of this year. We have good gross margins, so we can scale. We have negligible churn, and I think critically as well, we have an outstanding US sales team. So we have now 70 engineers over in Wellington, New Zealand, but also we have 70 people over in the US. That's a direct sales team, a customer operations team, a customer success team. So we're really geared for success. Unlike most SaaS companies, we actually have a lot of competitive moat around us, IP, papers, over 300 papers now, and regulatory clearances. And we have some real major catalysts coming up over the next few months. The FDA is going to make part of what we do mandatory. There's a huge trial coming out of the Netherlands, a 10-year randomized controlled trial, which is going to produce results which are going to be very positive for us. And we have lots of cross-selling opportunities via a company that we brought in June of this year. So let's just talk a little bit about the mission of the company. The mission, my mission then, saving families from breast cancer. Breast cancer is a disease which doesn't affect just the woman, it affects the whole family. So that's been our focus. As I said at the start, breast cancer screening saves lives. We are very positive around breast cancer screening. It reduces mortality by 20 to 40%. And so that's all good, but we understand, we know, we've seen the papers, we've seen the results. We know there's better ways of doing it, and our software is a key to unlocking those better ways of doing breast cancer screening. So I'm going to talk to you a little bit about that now. Before we do that though, I'm going to point out these little images down here. The black stuff here is fatty tissue, and the white tissue is glandular tissue. These are top-down views of the breast, so the X-ray camera is at the top, and the X-rays are passing through the breast, and that's the image that gets created. Glandular tissue is the tissue that produces milk, so you want lots of this to feed babies. Unfortunately, glandular tissue is also where cancers form. So the more glandular tissue you've got in your breast, especially later in life, the higher the probability that you're going to develop breast cancer. But also if a breast cancer forms, and those little white stars are meant to be breast cancers, if their cancer forms, it's much harder to see a breast cancer on a dense breast than it is compared to a fatty breast. So there's a real double whammy for women with dense breasts as compared to fatty breasts. We lead the world in breast density assessment, automatic, accurate breast density assessment. But as you'll see in a minute, we've gone far beyond that now to have a range of offerings for breast imaging clinics. Let's spend some time on this then. So we kind of split up what we do into clinical decision support powered by AI. So the woman walks in the clinic, She enters data around her BMI, her age, her family history and so on into what we call Volpara Quest. The x-rays are done using any x-ray vendor's x-ray machine. Volpara then automatically and objectively assesses those. This is Volpara Live. And it says, before that woman goes home, it says, these images are good, you can send the woman home. Or it says, yeah, this image over here is not very good because the nipple is not in profile or the left and right breasts are not symmetrical. Please retake the image before you send her home. 2 to 3% of all women get called back. As soon as they get called back by the clinic because the images aren't of good enough quality to read from, they think, I've got breast cancer. So it's an incredibly traumatic, anxious time for them, and it costs the breast imaging centre $200 each time that happens. Volpara Live was launched in December last year. We just started rolling that out in installing across the US at certain sites, and we're starting to get very, very positive feedback from it and some quite dramatic results in terms of decreasing the number of women that get recalled. So those images then go on to the radiologist. This is Jeannie up here, Jeannie Weiger up in Connecticut. Her job is to look at those images. She'll read 100 cases per hour, and her job is to look at all of those and detect the smallest signs of breast cancer you can see. And some of these signs can be 1 or 2 millimeters big. So it can be tiny, right? Her first job, though, is to assess breast density. She uses Volpara. In this case, Volpara says a C. So Jeannie knows that this woman's higher risk of developing cancer. So therefore, she's actually going to take extra care when reading those mammograms. She's also going to write in her letter, you are a C. You might also want to consider ultrasound or MRI as an additional imaging modality. Jeannie becomes concerned about one area of the breast. She clicks on it, and then Transpara, which we've recently licensed from a Netherlands company called ScreenPoint, pops up, and it says, Jeannie, you're right to be worried about that area. This is potential cancer. You should biopsy this. Or it says, Jeannie, don't worry about this area. It's very unlikely to be cancer. You can send, you don't need to recall this woman. So that's kind of what we call our clinical decision support systems. They're all powered by AI, based on years or if not decades of experience in this space. All that data then flows up into the cloud, into our practice management software. One of this is Aspen, which tracks patients over time. And the other part is Volpara Enterprise, which stores all the images and then produces imaging analytics to be able to say to the clinic things like, you have one technologist, Mrs. Smith, who's really overcompressing the breast. As she's doing that, you're going to notice a lot more complaints from women, and this is why women aren't coming back to your screening setting. You want to talk to her about better breast compression. Right the way across to saying, okay, one of your x-ray machines in Manly is not being used productively enough. You want to talk to those people about why that is and maybe get it serviced. And right the way through to some sites where the x-ray machine will be giving a very high radiation dose out. And again, we are able to spot that much earlier before it's able to do any harm. Critical thing about all of this then is all that data and all those images are flowing up into the cloud and they're available to us for product development. We have something like 16 million images now in the cloud. We have one of the biggest data sets in the world available to us for AI purposes to really develop new applications to help women avoid breast cancer. There are two aspects, as I'm sure many of you are aware, about US healthcare in particular. One is proving that you improve patient care, and we have plenty of studies out there now showing that. These are just the two. There's a huge study coming out from the Netherlands in the next few weeks, probably, 10-year randomized controlled trial, showing a dramatic decrease in nasty cancers caught. But also the other element then of healthcare is showing that you can improve profitability. So we have lots of sites now using our software, seeing massive reductions in cost to sites, plus increased revenues from women going on to ultrasound and MRI. We are a SaaS company. We're aiming towards $10 of ARPU, that's price per woman. We're not there yet, but we've now got, following the acquisition of MRS and the licensing of ScreenPoint, which is the CAD tool there, we've now got a full smorgasbord of products for our sales team to go into these sites across the US to sell. And I can tell you now, I was in Denver last week with the sales teams. They are very buoyant and looking forward to the next 2 quarters, which tend to be our biggest ones, with this range of products to offer. This is our installed base across the US, that 25% footprint. We have some great sites, MD Anderson, MSK, but then we have some of these huge sites as well, Kaiser Permanente, but also sites like Walter Reed. Walter Reed is part of the Defence Organisation and Veterans Organisation. It's a huge process to get into those organisations, and we are one of the only companies to get into there for breast cancer care. So that's given us a great footprint into the DoD. And we have these 2 amazing kind of drivers coming up. So the FDA, we talked about breast density earlier. The FDA, after 50 years of research, have now realised that and recognised that breast density is a critical part of women's healthcare. And they are about to mandate that all women in the US should be told breast density every time they're screened. That is going to put a huge focus onto breast density, and we are the world leaders then in the measurement of density. We're not just an American company, though. We do a massive amount outside the US. If you go to Adelaide now, almost every single clinic in Adelaide that does breast imaging uses our software. We have a great site in Sydney on the North Shore, plenty now in Melbourne and over in Perth. We do a lot in Asia. Breast cancer, very sadly, is going through the roof in Asia, and they're calling us in now to really help them support getting breast cancer screening programs started. I was in Europe over the last few weeks talking to many of the screening programs up there. Those screening programs tend to be population-based. They do not do anything without randomised controlled trials. So the huge study coming out of the Netherlands, the 10-year randomised controlled trial, which is now imminent, it's being accepted into a major journal, so that'll be out pretty soon. It's going to change the way these screening programs think about breast cancer screening. It's something which we as a company have been waiting for now for many, many years. I think will help women globally. So yeah, just some of the numbers which we put up today. ARR 15.7 million, well on track for the 17.1 million that we forecast at the start of this year. Market share on track for 27%, low churn, good gross margins, cash in the bank over 40 million, and so on. And yeah, critically then, all that information flowing into the cloud for us to use for product development. We've seen very strong growth year on year, and we see no reason why this shouldn't continue, given the traction that we've got now globally. Very experienced board. I'll just point out a couple of people. Roger Allen, based down here in Sydney. He was the venture capital person behind Allen and Buckeridge. Professor Sir Mike Brady, Professor of Oncology at Oxford, my long-term collaborator. People like Dr. Monica Sani as well, came out of GE Medical, to come and join us and actually move to Wellington to actually be closer to us. She sees what we're doing and sees how we're changing the world. Very experienced exec team. Mark Conager at the top there runs the commercial side of the company from Nashville. We've just brought on Simon Francis, COO over in Wellington, and Mark Morris at the bottom there, Executive VP now, Customer Success. He was previously the CEO over in Seattle, and he's been an outstanding addition to the team. Investor relations is a key focus for us over this next period. We did a lot. Singapore, UK, had some outstanding meetings over there. We'll be back in Sydney for the Wilson and Macquarie and Evans Partners Healthcare conferences over the next few months. But yeah, we're all building up now towards RSNA. It's the big trade show, 55,000 people, 1st of December in Chicago. That's really the stepping out launch of Volpara and MRS all combined. So something we're looking forward to. That's where ProMedicus go to. Mac 7 go to as well. It's an outstanding conference. That's the World Cup of Radiology. So we're very much looking forward to getting to Chicago. I'm going to skip this one a bit, but fair to say over the years more and more institutions now are coming on to our register. It still remains quite tightly held, but liquidity has been very good over the last few months. We are covered by Bell Potter, Morgans and Ord Minnett. So yeah, just I've talked around some of this. We have some excellent short-term drivers. RSNA is always a massive opportunity for us. The FDA, the DENSE trial, some of these are now imminent and will be out shortly. Longer term then, all that data is going to be an incredibly valuable source to women globally as we use that to develop new products to really help detect breast cancer early. And my personal aim is to get to a point of trying almost to prevent breast cancer, get to a point where we can get women onto preventative courses if they're at very high risk of breast cancer. And I'm just going to mention there at the bottom as well, lung. We want to replicate what we do in lung. MRS is already 10% of the lung cancer screening market in the US, so we've got a great foothold already with that. So with that, I'll close it off. I will be around for the next couple of hours. Please do come and ask questions. Thank you.